Welcome to Apnea Sleep Care. My name is Stephanie, and I'm one of the sleep coaches here at Apnea. Joining us today is Robert Miller, our Vice President of our Sleep Division. Robert's going to help us understand a little bit more about what sleep apnea is and the process through being diagnosed. Thanks for joining us.
Thanks, Stephanie. It's good to be here.
Can you tell us a little bit more about what OSA and obstructive sleep apnea is?
Certainly. So obstructive sleep apnea is where patients will have issues related to obstruction in the airway during the nighttime. In the milder forms of obstructive sleep apnea, that may just include snoring, all the way up to complete obstructive events where there is no airflow. Patients will still try to breathe, where you'll see the chest rise and fall, but the obstruction occurs over and over and over again during the nighttime that causes disrupted sleep, and in some cases, even a lack of oxygen.
What's the prevalence of obstructive sleep apnea?
Yeah, the prevalence of obstructive sleep apnea, it's estimated that there are about 30 million adults in the United States that have some form of obstructive sleep apnea. But the bad news is that unfortunately about 80% of those patients remain undiagnosed and untreated.
Wow. What are some of the treatment options once you're diagnosed with sleep apnea?
Well, really the gold standard for treatment from an obstructive sleep apnea standpoint is CPAP. It's continuous positive airway pressure. CPAP is where there is a mask that's placed over the nose during the nighttime, and there is a gentle stream of air that helps to keep the airway open so that patients are able to breathe normally while they sleep. There's also custom oral appliances. There are some surgical procedures and even positional therapy that are available for patients. And I would lastly sort of even add, in some cases, just lifestyle modification can be enough to be effective in treatment.
Is CPAP covered by insurance?
It is. The good news that all payers in general will cover patients who have been diagnosed with obstructive sleep apnea for their CPAP therapy. And CPAP is the gold standard. The Medicare guidelines do have a minimum requirement from an adherence standpoint. So typically that requirement is 4 hours per night, 70% of the time, over a 30-day period. But you do get 90 days to sort of get that 30-day period included and prove that there is adherence to CPAP therapy.
Thank you for joining us today, Robert. If you have been recently diagnosed with obstructive sleep apnea, our Apnea Sleep Care team would love to partake in your sleep journey. If your provider is prescribing you CPAP, please have them reach out to one of our local Apnea branches so that we can further assist you. We look forward to partnering with you and your provider to help treat your obstructive sleep apnea.